Hello everyone, welcome to study Ayurveda. Today we are going to study about the Shwasa, that is dyspnea. Nirukti Shwasati Vayu iti Swasaha Swasati Anena iti Swasaha Swasati iti Swasaha. All these three Shwasa may be either due to physiological or pathological conditions. Your physiological condition is during pregnancy and the people who is living in the high altitude regions, and sometimes we are stepping up by the steps. In that condition also dyspnea is seen. In case of pathology, pathologically it is a abnormal or distressful breathing for a person. It may be because of any pathology which is underlying. In some conditions, because of the pathology present in abdomen, like in case of ascites we are having severe dyspnea, and in case of the renal pathologies we are having dyspnea. In case of diabetes we are going to see the person with the dyspnea. These are the main complaints which are explained by the person. And pathologically, it is the abnormal or distressful breathing. Here, in pathological conditions, many of the systemic disorders, including the abdomen, in case of ascites, the person is having the symptom of dyspnea. In case of the renal disorders or renal pathologies, we are seeing the patient with the dyspnea. In case of any of the respiratory system pathologies, the dyspnea is the commonest symptom. And also we are seeing in case of diabetes mellitus there is a severe dyspnea, and also in case of the hypertension, anxiety, and any of these psychological causes there is a dyspnea is present. But mainly here shwasa or dyspnea, which is main and foremost cause for this, are any pathology which is underlying in the respiratory system, and other systemic pathologies are also responsible for the dyspnea. निधान विदाहि गुरुविष्ठम्बि वृक्ष अभिष्यन्ति भोजनैः शीतपानाशन स्थान रजो धूम आतपानिलैः व्यायाम कर्मभाराद्वा वेगात् आतप वेगात् अपतर्पणैः वेगात् अपतर्पणैः हिक्काश्वासाश्च काशाश्च नृणां समुपजायते. So first is vidahi guru vishthambi. Vidahi here is the spicy food which causes burning sensation in the stomach as well as in the chest region. Guru here is the heavy food which is taking longer time for the digestion. Vishthambi here is a fermented food or stale food. Can consider vruksha, dry food items. Abhishandi, the one which is obstructing or which takes longer time for the digestion, and even though after digestion it produces a strota avaroda, or it sticks to the strotuses and obstructs the flow of other nutrients to the respective uttarottara dhatus. Okay. Shitapana ashana sthana. Here the person who is exposing to the regularly the person who is exposing regularly to the cold air and bathing regularly with the cold water and taking the foods which are cold, which are very much predominance of cold. So this symptom of swasa, which is most commonest during this winter season, okay, just because there will be coldness is more in around the atmosphere, and by the intake of cold food items, also by bathing with the cold water repeatedly, these are the main causative factors which is responsible for triggering of this shwasa. So in most of the asthmatic patients, the patient with asthma is having a problem of severe dyspnea which aggravates during the month of October, November, and sometimes up to the December and January, just because it is a shita kala. Because of the increased shitata in the atmosphere, the person is having the aggravation in their symptoms. Okay. In case of Viharajadindhana, Rajo Dhuma Atapa Anilaihi, because of the exposure to the dust, pollen, mist, pollutants or fumes or the dusty wind or sharp sunlight. So these are the causes for it. So these conditions like the dust, pollen, mist, pollutants or fumes, they are more predominant. The person is exposed more during the period of winter season. So that's also, it is a main cause for dyspnea. In case of this has been increased, the incidence of dyspnea, the incidence of this severe breathlessness or distressful breathing is seen mainly in case of this season. And some people have the cough, repeated cough symptoms are also there. To pacify that, they have to do simple home remedy, that they have to take haridra and mix it with the guda, and along with the gruta, they have to take it daily early in the morning, so to prevent this. Vyayama karma advabhara. So excessive physical activity, heavy weight lifting, traveling or excessive walking. So it in turn does the increase of vata. So it makes the condition very severe. Apatarpanaihi. Apatarpanaihi here is mainly excessive langana. It does the vataruddhi. Other causes for this are mainly amadosha, which is because of ajina of anna, abhighataja, it may be because of any of the external injury, and also shukra kshaya, because of excessive indulgence in the vyavaya, it produces the kshaya of shukra, and vishamashana, addeshana, samashana. These all are the conditions which are responsible for the manifestation of this disease. Because Shwasa here, there is not only involvement of vata, pitta along with vata has been involved. So the pitta aggravating factors and vata aggravating factors are responsible for increasing the incidence or the prevalence of this Shwasa roga. Hikka shwasasta kashasta nrunam samupajayate. So this is the common nidhana for hikka, shwasa, kasa. So by adopting these nidhana, the person is most susceptible for hikka, shwasa or kasa, any of the either diseases. Of shwasa, pragrupam tasya rutpida, shulam admanamevacha, anaho vaktravirasyam, shankanisthoda evacha. So the Purva Rupa are mainly Vrutpeda, pain in the chest, Admanam. Admanam here is abdominal distension, Anaha, abdominal gurgling, Vakravirasya, that is tastelessness, Shankanisthoda, there will be severe pain at the temporal region. Okay. Next, this is according to Charaka. Anaha Pashvashulam cha Pidayan Hridayasya cha Pranasya cha Vilomatmam Shwasanam Purva Lakshanam. Here, anaha here is the abdominal distension, parshvashula, there will be severe pain in the flanks, hridaya pidata, pain or discomfort in the hridaya, pranasya cha vilomatvam. So the viloma gati of prana produces these symptoms, so that is the purva lakshana of shwasa.
Samprapti yada srotamsi samruddhya martah kafapurvakaha विषक्व विषवृजति samvruddhastata shwasan karoti saha. Here the Saprapti explains that because of the nidhana sevana, the kapha and vatati dosha prakopa occurs, and that leads to ama utpatti in the koshtha. So because of the ama utpatti in the koshtha, there will be vitiated pitta. So the shwasa, which is originated from the seat of pitta, that's why we call it as Pitta Sthana Samudbhava. Location of Kapha in Pranavasrotas is there. Because of that, it does the Vata Avarodha by Kapha Dosha in the Pranavasrotas, which in turn leads to the Vimarga Gamana of Vata. Okay, this Vimarga Gamana of Vata does the Vrukshana of Pranavasrotas and does the Rukshana and Shoshana of Rasadi Dhatus, mainly in the Hridaya and Uraha Pradesha. That does the production of disease called as Swasa. Samprapti Ghatakas of Shwasa Roga are: first dosha here is Pitta, Kapha and Vata Pradhana. Mainly three doshas are involved. Dushya is Rasa. Srotas involved is Pranavasrotas. Dushti Prakara is Sangha and Vimarga Gamana. Udbhavasthana is Pittasthana, that is Amashaya. Vektasthana here is Uras, Mukha, Nasa. Agni here is Jatragni is involved mainly. Roga Marga here is Abhyantara. Doshagati is Urdvagati. Swabhava is Ashukari. Bheda is Mahashwasa, Tamakashwasa, Ksudraswasa, Urdvashwasa, Chinnaswasa. Types of Shwasa or Bheda. Maho Urdva Chinna Tamaka Kshudra Bhedaistu Panchada. Bhityate sa Mahavyadi Shwasa eko Visheshatah. Vatadiko Bhavet Kshudrasta Tamakastu Kafodbhavaha. कफवातादिकश्चैव संसृष्ट चिन्ह संज्ञकाः श्वासो मारुत संसृष्टो महान ऊर्ध्वस्थता मतः. Types of Shwasa are mainly 5. Maha Urdhva Chinna Tamaka Kshudra. In that, it is because of its chronicity, it is considered as the Mahavyadi. And there will be Tridosha predominance is present in case of Kshudra Shwasa. Kapha predominant in case of Tamaka Shwasa, Kapha Vatadika is in case of Chinna Shwasa, and Vata is mainly predominant in case of Maha and Urdhva Shwasa. Lakshanas of Mahashwasa, as we have seen earlier that there is a predominant of Vata dosha in Maha and Shudra Shwasa. Okay, Uddhuya Manavato Ya Shabda Vat Dukhito Naraha. The Vata dosha, which is very intensively aggravated, which causes the breathing difficulty and produces loud sound during breathing. Okay, Uchchaihi Shvasiti. Uchchaihi Shvasiti means the breathing sound which will be heard by a long distance. Samvrutpo Matarshava Ivanisham. Here, that the sound which is produced by the person is like that of intoxicated bull, similar to that of sound produced by the intoxicated bull. Okay. Pranashta Jnana Vijnana Sata Vibhranta Lochanaha. There will be loss of consciousness and orientation. The person is not conscious about the date, place, and time. Okay. He is in the state of delusion or confusion. Okay. Next, we are having Vibhranta Lochanaha. There will be restlessness and rapid movement of eyes. Okay. Vivruttakshanano. The patient looks upwards. Okay. Baddha Mutra Varchaha. Baddha Mutra Varcha here is that there will be obstruction to the urination and defecation. There will be absence of urination and defecation. Vishida Vak. Dullness of the voice and unclear voice is produced by the person. Dinaha Prashvasitam. Dinaha Prashvasitam. Chasya Durat Vidnayate Prusham. The patient struggles and takes lot of stress for breathing, and the breathing sound can be heard by the person who is present at the longer distance or who is farther away from him. They can also hear the sound which is produced by the patient. Okay. Mahashvasopastrushtastu Kshiprameva Vipatyate. Here, the person who is suffering from Mahashvasa dies soon. Urdhvashvasa. Urdhvam Shvasiti Yo Dirgham Naja Pratyaharatyadaha. Slekshmavrita Mukhasrotaha Kruddha Gandha Vaharditaha. Urdhva Dushtir Vipashyamstu Vibrantaksha Itastataha. Pramuhyan Vedanatascha Shuklasyo Arati Piditaha. Urdhva Shwase Prakupite Hya Adaha Shwaso Nivruddhite. Muhyatastamya cha urdhvam Shwasastasyaiva Hantyasun. Here, the Lakshanas are Urdhvam Shvasati Yo Dirgham Na Pratyaharattadaha. The person cannot able to take the normal respiration even though after the long and deep inspiration. The person doesn't feel comfortable even after the long and deep inspiration. Okay. Slekshmavrita Mukhasrota. Here, there will be avarana of kapha over the mukha of pranavaha srotas kruddagandha vahartitaha urva dushtir viparyamstu. Here the eyeballs will be turned upwards. Vibhrantaksha itastataha, there will be loss of orientation. Pramuhya, there will be drowsiness. Vedanartascha, the pain over the chest and the flanks during respiration. Shuklasyo, there will be pallorness of the face as well as pallorness or dryness or whitish coating is present in the mouth. Arati piditaha, there will be severe body ache. Urdhva shvase prakupite, hya adha shvase nivruddhite. So urdhva shvase prakupite, here that the condition or the symptoms aggravates during the inspiration, deep inspiration. The person does not feel comfortable during deep inspiration. Adha shvase niruddhite, the person feels relief during expiration. Okay, next, muhyas tamyascha urdhvam. Muhyas tamyascha urdhvam shvasastasyaiva hantyasun. Muhya, here is there will be confusion, moha. Tamya, there will be blackish discoloration in front of the eyes of the patient. Okay, on the deep inspiration. Cha urdhvam shvasastataiva. Okay, hantya soon, the person who is suffering from urdhva shvasa dies soon. Chinna shvasa, yastu shvasati vichinnam sarva pranena piditaha na va shvasati dukkharto marmascheda vrugarditaha anaha sveda murcharto daihyamanena bastina viplutaksha parikshina shvasana raktaika lochanaha vicheta parishushkasyo vivarnaha pralapannaraha chinna shvasena vichinnaha sashigram vijahatyasun. The lakshanas of chinna shvasa are yastu shvasati vichinna. The chinna word means here to cut or to break in between. So here you have to understand that there will be breaking of or sudden catching of breath, we can say. There will be breaking of respiration, either the person takes inspiration and stops for some time and then goes for expiration. So there is no proper time gap between the inspiration and expiration. There is a loss of sequence, we can say here. Sarva pranena piditaha. Sarva pranena piditaha means here that it produces the troublesome condition to the patient. Na va shvasati dukkharto. So the person can't able to take the breath properly. Dukkharto marma cheda rogartitaha. There will be cutting type of pain in the marma pradesha. Anaha, that is abdominal distension. Sweda, sweating due to strenuous breathing. The person, because of the breaking of breathing in between, because there is a improper breathing for the person, he can't able to take the deep breath or can't able to expire properly, then it produces a severe strenuous exercises for it makes the person very stressful, that because of this strenuous breathing there will be sweating. Murcharto, there will be loss of consciousness. Daihyamanena bastina, will be burning sensation in the bladder. Viplutaksha, instability in the eye movements. Parikshina shvasan, decreased capacity of the breathing. Raktaika lochanaha, there will be reddish discoloration of the eyes. Ekalochanaha, here is mainly there will be reddish discoloration in only one eye. Vicheta, here is there is no other movements are seen. Parishushkasya, there will be dryness of mouth. Vivarnaha pralapannaraha, there will be delirium. Vivarna means here is discoloration of the mouth, face, body, skin. Pralapannaraha, here is the delirium. Chinnashwaseena vichinna sashigram vijahantyasun. The person with this dies soon. Shudra Shwasa. The name Shudra itself explains that it is a minor or least or less importance, or the one which is having less symptoms, okay, less severity. Rukshayasa udbhavaha koshte kshudre vata udirayan. Kshudra shvase na sovatyartam dukhe na anga prabhadakaha. Yet they explained that by the intake of vruksha ayasa udbhava, by the physical exertion or by the excessive dry food consumption, koshte kshudre vata udirayan, it provokes the vata from the koshta to move it upward and produces difficulty in breathing. Okay, dukkena anga prabhatakam, here that it produces the difficulty while breathing and makes the person to feel the pain in the udha pradesha. Okay, hinasti na sa gatrani na cha dukkho yatetare. They explained that it is not very much troublesome or not very much discomfort. It is not going to produce very much troublesome condition to the patient and not very much discomfort to the patient, but there is slight discomfort is present. Okay, nacha bhojana pananam nirunat yuchitam gatim. So there will be no difficulty for drinking as well as for eating the food. Okay, ne indriyanam vyetham na api kachit tapayet drujam. So it will not provoke. If provoked, doshas gets pacified easily. Okay, this is regarding the Kshudra Shvasa. So in the last line they have explained about the sadhya asadhyata of the all types of Shvasa. Those are na sadhya ukto balinaha sarve cha avyakta lakshanaha. So why it is considered as sadhya? Because it is sadhya in case of the balavan purusha. Okay, yapya in case of the person who is having the avyakta lakshana. There will be no proper manifestation of the symptoms because the symptoms are very mild in nature. The person might ignore it, the person might not observe it, the person may not feel discomfort with all these symptoms. Then it is considered as the yapya because it is not known and it will leads to the chronic condition. Because of that it is difficult for managing. Kshudra sadhyo matastesham tamakaha kritra uchyate. Kshudra is considered as a sadhya and tamaka is considered as kushra sadhya. Trayah shvasa na siddhanti tamako durbalasya cha. So all the remaining types of shvasa like mahashvasa, udva shvasa and chinna shvasa, they are asadhya in nature, and the tamaka shvasa in durbala purusha is considered as asadhya.